Coming. Andy Hetzel, the Vice President of Corporate Communications, Blue Cross Blue Shield of Michigan, is with us this morning. Good morning to you.
I appreciate your optimistic view of the weather, Michael.
It's got to come. It happens every year. Do you remember last year, the Michigan State-Penn State game at Spartan Stadium, and that's in the middle to late November. It was the same day as the Michigan-Ohio State game. People were out in shirt sleeves. It was sunny and warm that day. I'll never forget it. So our Indian summer is coming for sure.
It does happen every year, a couple times during the winter, it seems. So let's hope that it happens sometime soon this year.
The Kaiser Family Foundation says an employee's share of premiums for a family plan is going to rise about 14% next year. This is just across the board, across the nation. They're talking about higher deductibles, out-of-pocket maximums, plus bigger bills for doctor visits and drugs also expected. Does that sort of match the forecasting that Blue Cross Blue Shield does?
I can't give you an exact number, Michael, but the point of the Kaiser study is that pressures are continuing to flow downward from employers to employees for the costs that are associated with access to health care. That is something that we are very concerned about, and it's why Blue Cross is working very hard in collaboration with doctors and hospitals to make the healthcare system higher quality, much more efficient, and take some of the costs out of the system. Hopefully we can ease some of that pressure on premiums.
How come, I mean, that sounds great if you're a Blue Cross Blue Shield of Michigan a card holder, that you're working to keep the costs down and keep the quality up. How come that has the Attorney General and the U.S. Department of Justice all riled up?
Well, I do want to make a point that our collaborations with doctors and hospitals in Michigan, Michael, don't just benefit Blue Cross members. They benefit the entire healthcare system and everybody in Michigan who accesses it. Our patient-centered medical home initiative, for example, we're working with 1,800 doctors. It's the largest initiative in the country to improve the efficiency and the quality of primary care, to center the focus of primary care around the wellness of the patient, not the sickness of the patient. These practices are paid more by Blue Cross because they're making some expensive changes to how they do business. But those changes impact people who walk in the door with cards from our competitors as well as cards from Blue Cross Blue Shield. So one of our missions, Michael, in Michigan is to help improve the total quality of health care, and that affects every customer in the state. As it relates to the lawsuit that was recently filed by the Department of Justice, one of the things that we do for our customers that, frankly, our customers expect us to do is negotiate discounts with healthcare providers, with hospitals, doctors, and pharmacies that allow for them to access healthcare services statewide at the lowest possible price. And that is what we bring into negotiations, and we're very successful at negotiating prices downward while also providing a fair and reasonable reimbursement to providers.
So what will happen next? I mean, is this going to be a sort of a long, drawn-out process?
Well, we hope not. It's in federal court in Detroit, and our legal team is taking a look at their next steps. I think they have to respond to the suit within a certain specific period of time. And really, at this point, Michael, we're trying to clear up some misperceptions that have been caused by some of the communicating that's been going on out there by the attorneys on the other side of the issue. Blue Cross negotiates discounts for Blue Cross Blue Shield customers and members. We've been alleged to have negotiated upward the rates that other health plan members pay, and that is absolutely not the case. When we negotiate with a hospital, we negotiate a set level of payment for services for our members, for the people who walk in with a Cross and Shield card in their pocket. That's something that our customers expect us to do. It's something that we're proud to do because really what we do is deliver about $13 billion a year in healthcare savings through these discounts. It's important to keep healthcare coverage affordable for our members in Michigan, so we want to continue our ability to do that and not have it disabled by the government.
All right. Thank you very much. Keep us up to date, and we appreciate those efforts to be sure.
Thank you, Michael. I appreciate your time this morning.
You can always find out more information at bcbsm.com. That stands for Blue Cross Blue Shield of Michigan.